Hello YouTubers! I am so glad that you clicked on this video. When was the last time you thought about your pelvic floor health? Have you ever thought about your pelvic floor health? Is your pelvic floor health important to you? It should be. The pelvic floor is a group of muscles in your pelvic area. These muscles support the organs in your pelvis like a sling. The organs in this area include the bladder, uterus for women and prostate for men, and the rectum, the area at the end of the large intestine where the body stores solid waste. By contracting and relaxing these muscles, you control your bladder and bowel movements. When this muscle or muscles become too tight or too loose, you can develop problems. Pelvic floor disorders occur when the sling or the hammock that support the pelvic organs becomes weak or damaged or becomes too tight or too stiff. The three main types of pelvic floor disorders are, and are not limited to, urinary incontinence or lack of bladder control, fecal incontinence or lack of bowel control, pelvic organ prolapse, a condition in which the uterus, the bladder, and bowel may drop into the vagina and cause a bulge through the vagina or vaginal canal. Symptoms of pelvic floor dysfunction: back pain, shooting pains in the ligament area near the pelvis, contracting pains that come and go when highly stressed, so almost like contractions or Braxton Hicks contractions. When the person is highly stressed, they can experience contraction-like feelings when they have pelvic floor dysfunction. Starting and stopping and then restarting menstruation, even starting, stopping, lots of spotting during menstruation can be a symptom of pelvic floor dysfunction. Twitching near or around the anus at all times of the day. Muscle spasms in the pelvic region and surrounding muscles. Pushing feeling in the lower abdomen, heaviness in lower abdomen, twitching and muscle spasms in the vagina or the muscles in that surrounding area. So the twitching and muscle spasms can happen sporadically, or they can also happen during certain times of the day when you have pelvic floor dysfunction. You can have urinary problems such as urgent need to urinate, painful urination, or incomplete emptying of the bladder, which could cause recurrent bladder infections. So sometimes women, this will be the only symptom they have that tells a medical professional that they have pelvic floor dysfunction, is just recurrent bladder infections. And that's also some pelvic floor dysfunction is also something overlooked by doctors when a woman is experiencing recurrent bladder infections. Another symptom of pelvic floor dysfunction is foul smelling or really dark menstrual blood. Constipation, straining, or pain during bowel movements. Pain or pressure in the vagina or rectum. A pushing or pressure in the vagina or rectum. A pushing sensation in the vagina or rectum. A heavy feeling in the pelvis or a bulge in the vagina or rectum. Muscle spasms, my apologies. Muscle spasms in the pelvis. Painful or uncomfortable intercourse. Pain upon standing. Childbirth is one of the main causes of pelvic floor disorders. A woman A woman's risks tends to increase the more times she has given birth and the more times she has carried a pregnancy to term. The length of the woman's pregnancy can increase the risk. The way the woman gives birth also greatly influences the health of her pelvic floor muscles, as well as the size of the baby that she carried to term. So women who carry babies or have smaller babies have less risk of developing pelvic floor dysfunction. Some women tend to have bigger babies. Some women will have babies that are 7, 8, 9, 10 pounds, and that increases the risk of developing pelvic floor dysfunction. But the way a woman gives birth increases or influences the health of her pelvic floor muscles, such as a C-section, repeat C-section, vacuum assistance during delivery, forceps use during delivery, and vaginal tearing during childbirth. All of these things greatly influence the health of her pelvic floor muscles. Women who are overweight or are obese also have a greater risk for pelvic floor disorders. Having pelvic surgery, radiation treatments, and liposuction also can cause these disorders. For example, these treatments can cause nerves and other tissues, nerve damage and damage to the tissues in the pelvic floor region. Other factors that increase the risk of pelvic floor dysfunction include repeated heavy lifting, your posture, physical activity level, past accident history, rough sexual activity, possibly your genes, and even stress. I will link a website in the description of this video that explains how your posture plays a very important role in your pelvis health and uterine position. When you're experiencing negative or adverse symptoms, it is in your pelvis or in your abdomen, it is important to take a good look at your risk factors for pelvic floor dysfunction. Most can be easily done at home or with the help of a trusted holistic healer. There are tons of at-home remedies for promoting blood flow to the pelvis, detoxification, and renewal of your pelvic floor muscles and your uterus, fallopian tubes, and ovaries. There are tons of resources for pelvic floor massage and realignment. You can have it done or you can do it yourself at home, proven to get rid of pain and unwanted, unnecessary symptoms of the pelvic floor, pelvis, and lower abdomen. I personally focused on breaking up scar tissue after my C-section that helped me tremendously with getting rid of my phantom pregnancy symptoms and phantom kick sensations, as well as promoting detoxification that further promoted it helped me get rid of all my adverse symptoms in my pelvis, in my abdomen. Occasionally I do still get, twitches or like a buzzing sensation, almost like there's a bee, but I know it's my muscles like twitching. So I am still actively detoxing and, trying to continue to break up that scar tissue. So I am actively still healing. I just wanted to bring up the idea of pelvic floor dysfunction. Just another idea, another option to help you get rid of negative symptoms you might be experiencing. You don't have to live with these symptoms. You can be active in your health, and you can be active in your healing, and all you have to do is be willing to learn something new. So this is just another idea and another option for you in helping you live the life and have the body that you want. I know this information helped me tremendously in my healing process because it really was an eye-opener after my C-section, why I was experiencing so much pain in my abdomen and in my close to my uterus and in my uterus, I realized that I had to break up that scar tissue after my C-section, and that it was that pelvic floor dysfunction and this new scar tissue was contributing to my phantom kicks and my phantom pregnancy experience. So I hope this video helps someone in their journey to healing, because it is you can get overwhelmed so easily in your journey to healing. So I hope this helped clarify some things for you and maybe even gave you some ideas. If you have any suggestions for healing and wellness, please leave them in the comments. I really welcome anybody to give me any ideas for helping me to heal after a phantom pregnancy and just heal my body in general. I want to be healthy. Who doesn't? So be well, friends. Have fun. Happy healing. Bye.